they take your organs out of your body during a C-section. I'm a labor and delivery nurse, and I've seen hundreds of C-sections, and not one have I seen an organ taken out of someone's body. A baby has come out, and a placenta, which a placenta is technically an organ. So why during my first C-section, I heard the doctor yell, "I can't get her uterus back in." This is a great question, and this can be a little bit misleading to what I said previously, but it is true that some surgeons take the uterus and they place it on top of your abdomen. I tried to find a picture of this. It was hard to find exactly the right picture, but this is the best I could do. So the dark red part is all the uterus, and the uterus is still attached to your body. There's tons of huge uterine arteries that they would have to clamp and cut in order to actually remove your uterus from your body. So all the surgeon is doing is taking it out from your abdomen so that there's more kind of space for them to work and see where they need to suture, but they're never actually taking it completely out, because if they were to do that, it would be a huge surgery, which is called a hysterectomy, and we rarely ever do hysterectomies, especially during C-sections, because they are very dangerous surgeries when you are pregnant, because there's so much blood flow that goes to the uterus. So not all surgeons kind of invert the uterus in this way so they can suture up the lower segment better and have better visualization, but some surgeons do. It's kind of patient to patient specific and surgeon to surgeon, just their preferences. But this is kind of what it looks like. I'm gonna post a video on my Instagram with real photos of what it looks like. If you guys are at all interested, TikTok would take that down in 2 seconds, but if you are interested in seeing what it actually looks like, then you can head over to my Instagram to check it out. So as you can see, the surgeon would have to manually put the uterus back in through the incision that they took it out, and that's probably where they were having a little bit of trouble getting it back in. And usually that's just because the uterus gets nice and firm, and sometimes they have to put a little bit of pressure to get it in, but they always can get it back in. I've never seen a surgeon have to make the incision bigger to get the uterus back in, but sometimes it can be a little bit tricky. I'm not a doctor, but I have seen lots of C-sections, and from my point of view, this is what's happening during a C-section. I saw someone comment on my last video that their bladder was taken out. Again, it's the same kind of thing. All of your organs are attached with lots of vascular blood flow, arteries, veins, all that kind of stuff that would be really hard to actually completely take out of your body. And it would be a much higher risk surgery, and it would take hours and hours for them to complete. The only things that are taken out of your body during a C-section are your placenta, your baby, and then if you're getting your tubes tied, they will take a portion of your fallopian tube, or if for some reason you're getting a cyst removed or a fibroid, sometimes there's uterine fibroids that are removed, and all of this is sent to the pathology, and you should be informed of this at the time of the surgery. It is your right to know if anything was taken out of your body during surgery, so you will be informed if anything else was ever taken from your body during the procedure. We'll have photos and they'll be like, I have a photo of this organ that was like my husband took, of this organ that was on a separate table. I usually think that's the placenta. The placenta does look like an organ. Honestly, it looks a little bit like the liver. So it probably was that. It's usually not anything else. I have not been in any situation where it has been something else. I've had a couple emergency appendectomies, so an appendicitis, where they've had to take out the appendix at the same time as a C-section. But honestly, other than that, those are really rare circumstances that your doctor will communicate with you during the process.